Hello, everyone. My name is Caitlin Ayers, and I am here to talk about gender-based medicine with administrators. The first thing I want to talk about is the discriminatory issues within the workplace that are deemed solely based off of someone's gender. Um, there is a difference between sex, and gender. Sex is associated with biological characteristics, whereas gender is an associated interpretation of social and cultural values. Sex refers to either a male or female's reproductive organs and associated hormones that differentiate male versus female. That's textbook definition again, but that's what we talk about when we refer to the sex of an individual. Gender, however, on the other hand, is associated with the basic belief system of masculine and feminine characteristics. So in that situation is where you have transgenders and people that identify as something other than their born sex, if that makes sense. A known stereotype within, male versus female is females like the color pink and men like the colors black and blue, but ideally and realistically, it's based off of the individual as a whole. I have a best friend who is a male and his favorite color is pink. And do we judge him for that? A little bit, but it's based off the individual. It's not, you know, if you're a female, you have to like this, and if you're a male, you have to like this. And I think that causes a lot of issues is because people have their own belief system on what an individual should be versus what an individual actually is or identifies as. And we need to respect their beliefs just as we want our beliefs to be respected. Um, so that same kind of stereotype with the color situation, the pink and black and blue, it can be applied when referring to men and women in the workplace, especially for you guys, administrators. Oftentimes, men are more likely to achieve higher positions than women in the workplace, but that's not necessarily true when we're talking about administrators that are women in the workplace. In 2015, women made up 39.2% of the 17 million people employed in management occupations, including that of your guys' role as administrators. Um, the management occupation with the highest share of women was actually medical and health service managers at 73.7%. So if you think about that number, 73.7% of administrators or um, health service managers, those are all women. So that kind of takes things a different route here because it is a known stereotype again that men oftentimes take the higher position or they get the higher role within a company just because of their sex. Um, Other management occupations in which women share are greater than men's is human resource managers. 65% of human resource managers are women. So again, that dominates the men in those particular fields. Um, there are many, many different factors that affect men and women in the healthcare field. Both parties face different challenges on a day to day basis. And it can be a challenge that both male and female would face, regardless of the sex. But then there's also other issues that they would face privately, where a woman versus woman issue, man versus man, things like that. But both parties, like I said, are responsible for making sure that all of your patients or all of your residents feel respected and appreciated. So whether you are male or female, let's say you have a transgender patient or resident, it is your job as the administrator to make sure that they're treated with respect, treated with dignity, because they are human too. And my biggest philosophy, one of my favorite sayings actually, is that going into healthcare, you treat the public. And when you treat the public, you treat all of the public, regardless of what they look like, their religion, their culture, their beliefs. You treat all of the public in healthcare. And as administrators, excuse me, that is your guys' job to make sure that those guidelines and, those honestly just common morals are set out throughout your buildings to make sure that your staff follows that. Because if a patient identifies as the opposite gender, it has to be respected. There can't be a I don't want to work with that person, or anything of that nature, because like I said, they're all human and we treat all of the public. Um, so as an administrator, I know that oftentimes you guys specifically don't always partake in direct patient care, as in showering, changing briefs, helping them get dressed, those kinds of things. You're more on the administrative side of things, the paperwork side of things. But I just want you guys to be conscientious of that, and just, if you had to help out on the floor, or if you are working a shift on the floor, because some administrators do, I just want you to keep those kinds of things in mind, because that's very important to remember. People remember the way that you treat them, and people will remember, the way you made them feel. And I think that's a very, very important thing. So, um, administrators, like I said, excuse me, mainly focus on the paperwork side of things. So when we're still talking about transgenders here, when we're referring to them, that's where it kind of becomes a gray area, an iffy subject, because you can, when you speak to the person, if they are a man that identifies as a woman, you would obviously say, "Hi, ma'am," or she, her. You would use those kinds of words if it's a woman. But as the administrator, when you're doing paperwork or things like that, the gray area becomes, how do you document on this person? Because when you're adding somebody into the system, if they're a new patient in your building or a new resident, when you're putting their name into the system and putting all their demographics in and all these things, that one of the questions that pops up is male or female. We're not at the point yet where we have other options as unknown, or chooses not to answer, or identifies as this. And I think that in the future we will get there, but I don't see that happening anytime soon. So that's where that gray area comes in, where as an administrator you have to document based off of their um, I don't want to say genitalia, but their sex, whether they are male or female. That is how you have to do your paperwork, based off of that, regardless of what they identify as. Um, the risk factor with that, and having to document them as their born gender, is that they might become upset, because if you put it in the computer that they're this, but they identify as this, and somebody gets it wrong, that's the gray area again, where you don't want to upset them. You want, things to go smoothly, and you don't want to upset anybody, especially with something like that, because it can be a very sensitive subject to some. So, another issue that was brought up, when I was talking to some other people about this same topic, is the bathroom situation. Ideally and ultimately, in all facilities, the bathrooms are just labeled bathrooms. It's not men versus women, anything like that. But if in your building you do have, separate labeled bathrooms, that could pose, a risk where somebody might get offended if the woman that identifies as a male is using the male restroom. So again, great. Yeah, I know we talked about this, but these are just some points that I want to bring up, some things for you guys to think about, keep in mind, and just be conscientious of. So the last issue that I find with having to work with transgenders is that, like I said, the employees can pose a threat, if they have a different belief system, as to where they say, I don't want to help that person because they're this, or, different things like that. And again, this is when you remind your staff that, we treat the public. And when we treat the public, guys, what do? We treat all of the public. So keep these things in mind. Make sure you're educating your staff on the appropriate way to handle situations like this. Like I said, it's not something that is very prevalent yet, but it will be one day. So just be conscientious of it. That's all I'm asking. So something else that I wanted to talk about really fast is on social media, I have a friend who is transgender. He is a man who identifies as a woman. We go by the name Professor What. I don't know where it came from, but that's what she identifies as a woman. And it made me kind of upset, talking to her, because before I gathered all this information to speak with you guys, I wanted to talk to her and hear her side of things, just because I thought it would give me more insight and more idea and opportunity to learn, to speak with you guys. So, Professor What gave me a few very good examples on what it's like being transgender. Um, Again, a male identifies as a woman. So Professor What, when she has to go to her everyday job, she is not allowed to wear the wig, the makeup, the painted nails. Um, she has to go to work as a male. But then on her off days, or the days she's at home or on social media, is when we have our nails done, the makeup, the hair. And that made me kind of sad, because again, if somebody wants to identify as male or female, we have to respect that. And so for Professor What to have to change who they are, how they feel inside to appease society, is something that kind of made me upset. So some examples that Professor What was giving me when I was speaking to her, she said, imagine that you are writing with your right hand and everything is smooth, and it just feels right. Okay, she said, you're writing, it just feels right, it's natural to you because you're right-handed. But then you go to write with your left hand, and it comes out kind of weird. And she said, this is how it is being a transgender. You are the left hand, the male, but you feel more comfortable being the right hand, the female, and it's easier to write with the right hand. And I just, when she told me that, I really just sat there and said, huh, there's so many different examples, but I think that example stood out to me the most, after talking to Professor What, because it's logical and it makes sense. Again, for the way that she feels personally, that's the reality for her. So, the last thing that I want to talk about is the lack of gender-based prevention, management, and therapy guidelines that we have to follow. As administrators, it's your guys' job to make sure that the company and all your staff, all your employees, are properly trained and up to date on taking care of both genders. So, for example, what I'm trying to say here is, if a male is uneducated, let's say, on how to wipe a female, this poses a threat, a very big threat, because if we're wiping the wrong way, we risk UTIs, bladder infections, things of that nature, that can be deadly for the elderly, or those who are immunocompromised, anything like that. Any type of infection, is bad for any of your residents, because those kinds of things are always documented, and you don't want those kinds of things happening in your building. So it's very, very important that you educate your staff, and no matter how uncomfortable it may be for them, you do need to remind them that they are healthcare professionals. They came into this field as professionals. So if they need to be educated on how to properly wipe a female, take the time and educate them, and let them know that um, it's not funny, it's not a joke, it's very serious, and it can pose a very serious threat, to that person's safety and to their health. Um, So we need to make sure that we're staying up to date on um, the guidelines on how to treat individuals based off of how they identify. We need to make sure that we are keeping our staff educated and up to date on things. Um, and the last thing, the kind of my closing statement here, one thing that was included in the lesson here that I found to be really really interesting is that a person's sex impacts how they respond to medication. See, those are the kinds of things that we don't necessarily think about, but those are the things that are there. Um, so I was reading that and I said, that's really really interesting to me. So I'm just going to read you a little insert from this lesson because I found it to be quite insightful. Men and women digest and break down medication at different rates. Liquids and solids stay in a female's stomach longer than they do in a male's, allowing greater absorption of some medications. In the liver, Valium is broken down more quickly in women than men. As a result, a woman may need another dose sooner than a man would to achieve the same effect. Women may have different symptoms of a particular disease than men. And as the administrator, it is important that your staff is, again, educated and up to date, especially if they're passing medications to individuals. So that doesn't necessarily come from your med techs, your nurses, your caregivers, even you guys as administrators. That's more so on the doctor side of things. They're the ones that know the absorption rates and those kinds of things to prescribe accurately. Um, but again, just a thought I wanted to put into your head, something for you guys to hold on to, think about, and just think about all the things that I brought up today. And I think if you take everything that I said into account and, focus on each one individually, that it's going to make the workflow for success that much better. Um, you guys are doing a great job as administrators. I know your job can be very, very stressful at times because you're the big dogs and everything comes to you. But that's why I wanted to make, this video. It's your guys' responsibility to make sure that the residents feel safe and cared for. So make sure you stay informed, stay up to date, do some extra research, do some extra reading, do those things, those little tiny things to make sure you're educated. Because the patients or the residents will notice that if you point something out that is specific just to them because you took the time to do that little bit of extra research. So again, I want to thank you guys for coming, for listening. If you guys have any questions, feel free to reach out to me, and I will post my information within this video. Thank you guys so much and have a good evening.